Hi guys, I'm Dr. Joseph Cipriano, and today we have our patient here. So last time we had a video, she was having rib issues that were going on. She's now been a patient for, it's been a couple months now. And so today, just give me a little rundown. How have you been feeling?
I feel good, better than I ever have before since I started the chiropractic here.
Okay.
It's been good.
Good. So now, this is a patient where she's been, under a wellness type care plan, and she's not experiencing headaches, migraines, sciatica, low back pain, mid back pain, neck pain. There are no symptoms that she's having. This is the ideal patient that we want. This is where we want all of our patients to get to. We want to get you out of an issue and back to owning your body and having no pain, be able to do the things that you want to do. All right, so I'm gonna have you lay face down for me. We're just gonna go and check everything. Keep you aligned, keep everything going right. So even right from there, right from the get-go, when I look at the leg length is looking very well here. This is exactly what you want. She's been under care for a few months now, and as you can tell, she keeps up with her care plan and things are going great. So I'm going through, I'm palpating in the spine, just making sure and feeling how everything is going today. Obviously the good thing is she's not experiencing any symptoms. The last time she was having quite a bit of rib pain, so this is a good thing that the adjustments have been holding and that she's feeling rather well. So even as I scan her spine and I'm going down, I'm just finding simple misalignments. She doesn't have a scoliosis. There's nothing, there's no like red flags, anything that's jumping out at me. Also, it correlates with her not having any symptoms as well. So it's just a little bit in a few areas that are a little bit tight. Up here in the neck, more on the left side here, we have a little bit of tightness. That's going to be one of the main areas. And then I also want to check, and I like to scan down on the back. So as you can tell, we got a little bit of rotation going towards this left side like this. So I want to work on a little bit right through here. Okay, so let's go ahead and we're going to get the adjustment started here. So if you want to come on in. So I always like to start with right here at that cervical thoracic junction, roughly between T3 to about C6. This area, it's where a lot of people tend to hold a lot of that tension. So we're gonna come in here. This left side is a little bit tighter than the right, so what we're gonna do, just relax. Good. Got a little bit of movement here. Actually, already just that little bit, I feel that muscle not as tight, which is a good thing. Okay. Now on the other side, it's a little bit lower, more towards that T3 area. Good. Perfect. Worked out great. Both of those, seeing that, as you can tell, you're holding the adjustments very well. And then we'll come through on that. We're going to do the thoracic spine. We'll do a couple different ways, but we'll start out like this if you want to come in. Deep breath in and let it all out. Good. One more time. Deep breath in, let it all out. Perfect. Okay. Now this one, I just want you to turn on your side and face me. We're gonna bend that top leg. Keep that bottom one straight. There it was. Perfect. Lay flat on your back for me. Yep. So with her today, when we were looking at her hips, we saw that little bit of rotation on the one side. So we're just doing that one side with that side posture adjustment. Now I'm gonna go through and do leg pulls. We just wanna, work on the knee, the hip, and that lumbar spine. So we get a nice pull in through here. I felt that move. Good. Come on up. Perfect. So now what I'm going to be doing, we're just addressing her cervical spine. What I do in here is I check everything for symmetry. So I do lateral flexion on either side. And I go down each segment, and I just like to feel how each segment moves compared to the other side. So not only do we do a lateral flexion, I'll go through and do a rotation on each side and just really feel the joint play. So what this is called, this is just your normal palpation. And as I'm feeling, we're getting a little bit of restriction on her left side. It's not much, but I just want to get these joints opened up a little bit better. So what I'm going to do here, gonna laterally flex, bring you to the side. Good. I'm gonna go a little lower, adjust it from this side. There it was. Okay, so now I'm just gonna recheck on either side, feel how that's moving. Good. See, today, that you're not experiencing many symptoms. Everything is actually holding a lot better. Everything, we're getting movement, but it's just slight movement is all that you need. What I'm gonna do, I'm gonna have you stand up. Face that way for me. So I'm gonna just make sure I clear out the rest of that thoracic spine. So I am going to put one hand right here, and put your hands on top of mine just like that. We'll bring your necklace around. Alright, so how my hands are, how my fingers are crossed. Okay. Put your hands literally over my hands like that. Yep. Like interlock your fingers. Good. So with this, what I'm going to do, I'm going to bring you down. Squeeze your elbows together, tight as you can. Good. Got a little bit of movement right through there.
Yeah, I felt that.
Perfect. I'm going to have you lay face down. I just want to make sure and check everything and get you on your way. So today we are lucky to be in beautiful Charleston. Amazing weather today. It's such an awesome thing to be able to set up and be able to do traveling chiropractic care at any location possible. So perfect, even at the end, rechecking the leg length again. Still, legs are completely balanced. These are issues that we're looking at, in scanning the body. Everything's looking balanced. When we come through, gonna repalpate the spine, just check everything. Everything's feeling all actually very good. Very good today. All right, I'm gonna have you sit up. Any issues with shoulders, elbows, wrists, anything like that? No? Going good?
Yeah.
Perfect. All right, I'm Dr. Joseph Cipriano, and this is actually where we want all our patients to get to, being a wellness patient and not experiencing any symptoms anymore. Have a good one.